Hello, I am Laura Banak Jardim.
Hello, I am Ali Hassan.
Today we are here doing this footage in order to demonstrate how to perform the Neurological Examination Score for Spinocerebellar Ataxias, or NESSCA. Please read the manual in order to learn how to score each item after performing the test. Today also is February 4, 2021, and we are in the middle of the COVID-19 pandemics. We are both already vaccinated. Since my voice needs to be well captured by the microphone, I will not use the face mask while shooting. Now we can present how to perform item 1, gait ataxia. Tell the subject to walk naturally, at least 10 steps, perform a half turn and return. The subject should walk next to a wall. The walk is done until a good judgment is guaranteed. Thank you. Continuing again on item 1, gait ataxia, but now tendon test. Tell the subject to walk foot to foot as if in a line, touching the tip of toes against the tip of the heel. The examiner should demonstrate how to do the tendon walk. The subject should walk next to a wall, or the examiner should accompany the walk, protecting the subject from falls. The tandem is done until a good judgment is guaranteed, maximum of 10 steps. Wait a moment. Do this, okay?
Okay.
Can you come?
Yes.
Come, can come. Okay, thank you. Now how to perform item 2, upper limb ataxia. Finger to nose test. Tell the subject to abduct their arms to 90 degrees with the index fingers in a pointing position. Then instruct the subject to touch the tip of their nose with one of the index fingers and return, alternating the gesture between one arm and the other. The individual is seated at the examination table. The examiner must demonstrate how to perform the test. Ali, please do this. Thank you. Continuing. Now testing diadochokinesia, also belonging to item 2, upper limb ataxia. Part 1. Tell the subject to place both hands over the thighs and then quickly alternate the palms versus the backs of both hands, hitting the thighs. The movements should be done as quickly as possible. The individual is seated at the examination table. The examiner must demonstrate how to perform the test and must maintain the proof until certainty of judgment. If this test is normal, proceed to the next command. So Ali, please do this. Thank you. Now, the second part of diadochokinesia, item 2, upper limb ataxia. Tell the subject to place the palm of one hand over the other hand. Then tell them to tap the palm versus the back of this hand on the other hand as quickly as possible. The individual is seated at the examination table, and the examiner must maintain the proof until certainty of judgment. This proof is not necessary if the previous one was already altered. So Ali, please do this as quickly as possible. Please change the hand. Thank you. Done. Okay. Continuing on item 2, upper limb ataxia. Now the rebound test of Gordon Holmes. Explain the following to the subject. Flex your forearm with fist closed, approximately 60 degrees towards your chest. I, the examiner, will place my forearm, fist closed too, against yours. You turn your face away. Wait for my signal to start the test. I will pull your forearms towards me and you will need to resist intensely. Don't let me move your forearm. After we do it on this side, we will do this on the other side. The individual is seated at the examination table. The examiner helps the subject to assume the posture described above. The examiner supports her body on the exam table to maintain her balance during the test and initiates the effort to displace the subject's forearm. The examiner should remove her forearm abruptly and without warning and observe if there is a rebound on subject forearm. This test can be repeated until it is guaranteed that the subject performed it well and that the examiner had a good judgment of its result. Let's do it. Please, fist closed. So again, turn your face there. So pull me, pull me, pull me, pull me. Again, please, pull me, pull me, pull me, pull me. Okay, the other side. Your face there. Okay, pull me, pull me, pull me, pull me. Again, pull me, pull me, pull me. Thank you. That's it. So now how to perform the items 3, nystagmus, and 4, external ophthalmoparesis. The examiner should look at the face of the examiner in front of him at the same height and observe if there is a permanent nystagmus for item 3 or strabismus for item 4 during the central fixation until the decision is guaranteed. Ask the individual to stare horizontally after that 15 degrees to the right and then to the left for a few moments in order to look for gaze-evoked nystagmus for item 3. Then proceed to examine if gaze at the horizontal and vertical extremes is sustained without paresis. The individual is seated at the examination table. So please, Ali, stare at my nose first. Thank you. Now look at this. Stare. So there is no gaze-evoked nystagmus. Then now here. Thank you. Now pursue the pen wherever it goes. So no paresis, neither nystagmus. If you want, also you can do this. Thank you. Now finishing item 4, external ophthalmoparesis. Ask the subject to fix his eyes on a wall at least 2 meters away. Suddenly you will present a pen or something, an object 15 centimeters in front of the subject eyes and ask him to focus on it. Observe the convergence obtained. So Ali, look somewhere at distance. Then please look at here. Look. Look at the distance. Look here. Thank you. So how to perform item 5, pyramidal findings. Strength. Examine the postures sustained for 60 seconds of the outstretched arms or pronator drift test. And after that, the Mingazzini maneuver. Second, muscle tones. Move passively the forearm from flexion to extension and the leg from extension to flexion until you find some resistance and until you guarantee your judgment. For lower limbs, with subject lying down, rapidly flex each thigh after instructing the patient to let the leg flop. Normally, the heel will be dragged across the bed from the beginning, whereas the spastic leg will jerk upward before touching the bed. 3. Stretch reflexes of the flexor muscles of the fingers, styloradial, bicipital, tricipital, and pectoral muscles, and also patellar, thigh adductors, and Achilles reflexes. 4. Presence of patellar and Achilles colonus, and 5. Presence of Babinski sign. The tests of strength and tonus of the lower limbs are mandatorily performed with the subject lying down. Perform all the other tests in the sitting position if possible. So let's gonna start. Ali, please stand your arms, open your fingers, close your eyes, and stand like that for 60 seconds. But of course, we will not do this. Thank you. Now we will see your tonus. Let your arms floppy. Great, really, really floppy. Now I will extend the forearm and then flex. Stand and flex to look for any resistance. Then on the left side, flex and extend, flex and extend, flex and extend. I like also to see the fist, especially because if you have any rigidity, I will see here also, yeah? Thank you. Now, the reflexes. Flexor of the fingers. Styloradial. Bicipital. Just to remember that we can look for hyperreflexia. Bicipital. Tricipital, let it floppy. Pectoral. I will take this from you. Thank you. Let your legs floppy, floppy, floppy. Yeah. Patellar reflex. Okay, so thigh adductor. And Achilles ones. Let your foot floppy, floppy. Thank you. Let it floppy. I will look for your Thank you. Can you lie down, please? Now flex your thighs, now your feet. Close your eyes. Let your hands down here. This is the Mingazzini maneuver. This is the posture that should be maintained for 60 seconds. And of course, you can put your hand here in order to prevent one foot to touch the other one. Ali doesn't need to be for 60 seconds in this position. Thank you, Ali. It's just to demonstrate. Now let your legs floppy again, floppy, and then I will suddenly, when he doesn't know when I will do that, I will flex the thigh suddenly, and you can see that the heel is maintained in the bed because Ali is not spastic. Now I will look for how is your tonus of your leg. Now I will take your right leg, let it completely floppy. Thank you. Now I will flex and extend, flex and extend. The other leg also, let it floppy, flex and extend, flex and extend. That's it. So items 6, the dysarthria, and 7, dysphagia, do not require film demonstration. So now, how to perform item 8 about fasciculations. Observe arms and legs at rest for a few seconds. If there are no fasciculations, ask the subject to show their teeth and close their eyes tightly while you watch the face, especially around the eyes. So I'm supposed to be looking for fasciculations. I can't see anything. Then I will move. Please show your teeth and close your eyes. Translate, and we will look for contraction fasciculations. There is nothing here. Thank you. So now, how to perform item 9, sensory loss. The subject is lying down during all tests. How to test vibration sense. Place a vibration 128 Hz tuning fork at the tips of the subject's fingers to demonstrate vibration sense. Then examine how long the subject feels vibration in the interphalangeal joints of the first use. Activate the tuning fork, start the stopwatch, place the tuning fork at the interphalangeal joint of one of the first tools. Ask if the subject is feeling vibration. If you are not sure that he distinguishes tactile from vibratory sense, stop the vibration without the subject seeing and ask again. Record the average obtained from both sides. That's gonna start. So this is my tuning fork. Give me your hand. Put your fingers. Are you feeling vibration? This is the vibration. Can you lie down, please? With your, I can. Okay. Are you comfortable?
Yes.
So, activate, start stopwatch, interphalangeal. Are you feeling?
Yes.
Vibration? When it finishes, you tell us.
It finished.
Okay. And again, the other side. Are you feeling?
Yes, I'm feeling.
When it finishes, you tell us.
It finished.
Okay. So I took both measures and do the average. Thank you. Now, next step is the pinprick test. Remove the needle from its wrapper and make it blunt, preferably in front of the subject. Demonstrate the difference in touch between the sharp and dull tips of the needle until the subject understands the test. With the subject in supine position and without looking at his feet, ask him to inform the stimulus he feels. Randomly alternate touches with the sharp and dull tips on the back of one foot. You can make 3 quick touches per stimulus to ensure discrimination. If the individual does not miss 5 stimuli, consider the test normal. If the individual misses a stimulus, increases it to 10 stimuli. If the individual does not respond to a stimulus, ensures that he is attentive. If he doesn't respond again, consider it an error. Repeat on the back of the other foot. Record the average number of mistakes obtained from both sides. Can we start?
Yes.
Okay. So this is the needle. It is already blunted here. So this is Ali. This is the sharp point, and this is the dull point. Can you discriminate? Dull?
Dull, sharp.
Sharp. Okay. So now, you will tell me when you feel and what you feel.
Okay. Dull, sharp, sharp, dull, sharp.
So 5 correct answers.
Dull, dull, sharp, sharp, dull.
5 correct answers. Thank you. And the last step of the sensory losses, item 9, is the temperature sense test. Put cold water around 10 degrees and heated water around 40 degrees Celsius in plastic cups. Demonstrate the temperature difference in the subject's upper limbs until he understands the test. With the subject in his supine position and without looking at their feet, ask them to inform the stimulus they feel. Alternate random hot and cold touches on the back on one foot. You must hold the cup in contact with the skin for 2 seconds to ensure discrimination. If the individual does not miss 5 stimuli, consider the test normal. If he misses 1, increase it to 10 stimuli. Repeat on the back of the other foot. Record the average number of mistakes obtained from both sides. Can we start?
Yes.
So, we have hot water and cold water. Can you stand your forearm? So, this is hot.
Okay.
This is cold. Are you feeling the difference? Yes. Okay. Can you tell me what you feel when you feel?
Okay.
Can I start?
Yes. Cold. Cold. Hot. Hot. Cold.
Can I do in the other side?
Yes. Cold. Hot. Hot. Cold. Hot.
Okay, it's done. So item 10, dystonia, does not require film demonstration. Item 11, rigidity, should be evaluated during proofs of item 5 already demonstrated. So now how to perform item 12, bradykinesia test. Ask the subject to perform 10 cycles of repetitive opposition of the extension and flexion of the second finger against the thumb. The examiner evaluates amplitude and speed of movements, and the proof is bilateral. Do you see what
Yes.
I'm asking? Can you do that? Thank you. The other side? Thank you. Okay. Item 13 about eyelid retraction only asks if the finding is present on inspection. So now we will see how to perform item 14 about blepharospasm or apraxia of eyelid opening. So you need to look if there is first spontaneous, uncontrollable contractions of the eyelids. And of course there is nothing on this in you, okay? And after that you see if there is inability to open the lids following forced voluntary eyelid closure. So Ali, please close your eyes strongly, sustain. Can you open? Do it again, close and open. Thank you. Items 15 about distal amyotrophies, 16 about sphincter function, 17 about cramps, and 18 about vertigo do not require film demonstration. So we hope you have enjoyed and you have learned how to perform NESSCA items, but we need to remember you to please read the NESSCA manual in order to understand how to score each item. Thank you.